If you were over the age of 40 and you think that a heart attack or stroke will always come with a warning sign, listen very carefully. There is a silent artery disease that develops slowly, causes no pain, and often shows up in the legs first. Many people in the United States are walking around feeling completely healthy while their arteries are already narrowing, and they have no idea it is happening. Blocked arteries are often called silent killers, and the reason is simple. They develop gradually over the years without obvious symptoms. You could be one of those people who feels fine today, yet your arteries may already be partially blocked. What if I told you there is a simple way to get an idea about the health of your arteries at home using just a blood pressure cuff? This is not a trick or a quick hack. It is a medically proven method called the Ankle Brachial Index, or ABI. And by the end of this video, you will know exactly how it works, how to check it at home, and what to do if your numbers are not normal. ABI is a simple, non-invasive method used to screen for blocked arteries in the legs. By detecting problems early, you can take action before serious complications happen. In fact, identifying these issues early can help prevent heart attacks, strokes, and even limb-threatening complications. In today's video, I will explain exactly how ABI works, how you can measure it at home, how to understand your results, and what steps you should take if something comes back abnormal. So let us first understand what the Ankle Brachial Index actually is. It is also called the Ankle Brachial Pressure Index. Before you start measuring it, it is important to understand how it works. In simple terms, ABI compares the blood pressure in your legs, specifically at the ankle, with the blood pressure in your arm. Normally, the pressure in your legs should be equal to or slightly higher than the pressure in your arms, because blood flows freely through healthy arteries. But when arteries become narrowed or blocked due to plaque buildup and atherosclerosis, the pressure in your legs starts to drop. As a result, the pressure in your legs can become lower than the pressure in your arms. This difference is calculated as a ratio. When we perform an ABI, we measure the blood pressure in the arm, measure the blood pressure at the ankle, and then divide the ankle pressure by the arm pressure to calculate the ABI. A healthy ABI usually falls between 1.0 and 1.4. Anything below 0.9 suggests that there may be some blockage in the arteries. The lower the number, the more severe the blockage. If the ABI drops below 0.5, it can indicate a serious condition known as critical limb ischemia. This test is simple, does not require complicated equipment, and is not expensive. It is also important to understand that peripheral arterial disease, or PAD, is not just a leg problem. When someone has blocked arteries in the legs, it is a strong warning sign that arteries in other parts of the body, including the heart and brain, may also be affected. So detecting a problem in the legs gives you a valuable opportunity to take preventive action before serious events like heart attacks or strokes occur. You may be wondering why this is such an important issue in the United States. Studies have shown that a significant number of adults over the age of 40 may have peripheral arterial disease without realizing it. This risk is especially high in people with diabetes, high blood pressure, high cholesterol, obesity, insulin resistance, or a family history of heart disease. Symptoms like leg pain while walking, numbness, slow healing wounds, or changes in skin color of the feet are often ignored. Many people assume these are just signs of aging or lifestyle issues rather than symptoms of an underlying vascular problem. ABI allows you to detect these problems early before major complications develop. By connecting the dots early, you give yourself a chance to slow progression and protect your heart, brain, and legs. Now let us look at how you can check ABI at home using just a blood pressure cuff. Many households already have a blood pressure machine, and that is all you need. Ideally, it helps to have someone assist you. Start by lying down and resting for at least 5 minutes. Your body should be relaxed, because stress or recent physical activity can affect the readings. First, measure the blood pressure in both arms and record the higher reading. This will be your reference value. Next, place the blood pressure cuff just above your ankle and measure the pressure in one leg, then repeat it on the other leg. Make sure your leg is relaxed and your foot is not tense or bent while taking the measurement. The cuff should be snug, not too tight and not loose. Once you have the numbers, divide the ankle pressure by the higher arm pressure. This gives you the ABI for each leg, meaning you will have one ABI value for the left leg and one for the right leg. A normal ABI ranges from 1.0 to 1.4. A reading below 0.9 indicates some degree of artery blockage. Anything below 0.5 is considered severe and requires urgent medical attention. This method is effective because it directly compares blood pressures and shows how well blood is reaching your legs. However, it does not tell you exactly where the blockage is located. So once you know your ABI numbers, what should you do next? If your ABI is within the normal range, it means blood flow to your legs is adequate. If your ABI is below 0.9, it suggests mild blockage, which can often be managed with lifestyle changes and regular monitoring. If the ABI falls between 0.7 and 0.9, this indicates moderate blockage. At this stage, you should consult a vascular specialist. Further tests, such as a Doppler ultrasound or angiography, may be recommended to identify the exact location and severity of the blockage. Anything below 0.7 indicates severe blockage, and values below 0.5 raise concern for critical limb ischemia, where the risk of ulcers and gangrene becomes very high. In these cases, evaluation by a vascular specialist is essential. It is important to remember that ABI is a screening test, not a definitive diagnosis. Abnormal results often require further testing, such as Doppler studies, CT angiography, or other imaging tests to guide treatment. If your ABI is low but not in a critical range, lifestyle changes become extremely important. Regular walking can improve circulation. A healthy diet with reduced sugar and refined carbohydrates helps slow plaque buildup. Quitting smoking and limiting alcohol intake are also critical steps. You should also consult a vascular specialist. Depending on the severity, treatment options may include medications, minimally invasive procedures, or surgery in more advanced cases. Regular monitoring is key. If an ABI is abnormal, it should be rechecked every 6 months, or as advised by your physician. This creates a continuous cycle of prevention, early detection, treatment, and monitoring. Let me now share a real-life patient example that shows the power of ABI. A 60-year-old gentleman from the United States came in for a routine evaluation. He had been experiencing mild leg cramps while walking for several years, but had ignored them. He had consulted orthopedic specialists, undergone physical therapy, and even had an MRI, which was considered normal for his age. He was told it was likely just an age-related issue and advised to reduce walking. After watching one of my videos, he came in for a vascular evaluation. On examination, his leg pulses were weak. A simple ABI test revealed moderate blockage in both legs. With medications, lifestyle changes, and regular monitoring, his walking ability improved significantly. Follow-up tests showed no progression of the blockage. He did not require angioplasty or surgery and continues to do well with conservative management. This is the power of early detection using ABI. If you want to learn more about the warning signs of blocked leg arteries, subscribe now.